So let's learn about implant reconstruction of the breast. So we'll see the first indication. Okay, so indications are, if you are planning to do bilateral reconstruction, because in implant it is better to do the equal on the both side. Okay, so it is easy to do the what do you call the size of the both side you can manage. Okay, similar. Then it is bit difficult with the flap and all. Okay, then the patient, if requesting the augmentation. Okay, so augmentation in this bilateral is the keyword, augmentation in addition to reconstruction. So for augmentation you have to put implant. Okay, now is patient is not suited for long surgery, because if any kind of flap reconstruction, it will take time during surgery. So if patient is not suited for long surgery, so you can go for implant. Okay, now is lack of adequate abdominal tissue. Oh, okay, if there is no abdominal tissue, from where you will take flap? So better to do implant. Okay, and again patient is unwilling to have additional scar over the back or abdomen. So patient don't want to put additional scar, so put implant. Okay, next is small breast mod with minimal ptosis. Okay, so patient should have a small breast, so that implant should fit properly. Okay, with minimal ptosis. Okay, so let's see the contraindication. Okay, so if the patient is very young, this patient, because implant has comes with the life. Okay, so a young patient may need implant replaced multiple times, so better not to do in young patient. Okay, next is, if the patient is unwilling to adhere the follow up. Okay, because implant related complications are there, so patient need regular follow up. So if patient don't want to do follow up, better not to put implant. Okay, then large and ptotic breast. Okay, so if you put the implant in very large and ptotic breast, it will move in and around. Okay, so doesn't look good. Okay, so better not to put in large and ptotic breast. Okay, okay, if the patient have silicone allergy, because that implant is made up of silicone, so don't put if the patient is having silicone allergy. Okay, now if the implant fear, if any patient has implant fear, this may turns into cancer, this may rupture, so better not to put the implant. Okay, then if the patient has previous history of failed implant, so high chance this implant is also going to fail, so do not put the implant. Okay, and the last one is, if the patient need adjuvant radiation therapy, so don't put implant, because after giving the radiation, implant related complication will be high. Okay, so this is important table and bit confusing, especially the small breast point and bilateral. Okay, okay, and these points are important. Okay, okay, thank you.